You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Tulsa's go-to implant dentist, Dr. Ty Barnes. Dr. Barnes, welcome to the program.
Thank you, Randy. Thank you for having me.
Now, you brought a stack of photos, so we'll get to as many of those as we can. Now, for people that don't know your practice, like who's the typical dental implant patient?
Well, we see pretty much anybody from 18 to over 90 years old. So we see patients from all walks of life, but all of those can be sorted into two primary categories and this is easily over 90-95% of our patients. One are current denture wearers. They've either recently gotten a denture or they've been wearing it for decades. And then two, patients that are soon to become a denture patient, either with painful teeth, bleeding gums, infection, bad breath, whatever it may be, or have been told by another dentist that they need to have dentures. And so those are our primary patient types.
So even though you do a lot of dentures, but people go to you because they don't want dentures. Mm-hmm. Is that right?
True.
In fact, you said somebody flew in from Maine.
Yes, so we had a patient that we've had and we've been treating for the last year actually refer in a friend of his from Maine where she'd been quoted close to double what our current charge is. And so she flew down, and then this Monday she had her consultation, and Wednesday she had her procedure where she left with her new permanent teeth.
Really?
Yeah.
So somebody watching this, like let's say they had no teeth. Mm-hmm. The day after tomorrow, I mean, of course, if everything works out and you had room in your schedule, they could have upper and lower teeth that don't come out.
Yeah, yes, sir.
Or if they have bad teeth, same thing.
Yeah, typically it can be in as few as a few days. Our typical spread is usually a week, week to week and a half, so there's no real time delay.
Now, at the top of the show, we said no more traditional dentures. Do you think that's the future of dentistry, where dentures as we know them, like the way you make them, will be gone? That means all dentures will be attached to something. What are your thoughts?
One of these days, I think it's drifting that way, but there's still plenty of room for conventional dentures. So some patients have gone years just being self-conscious of their smile. They don't like to go into a convenience store and get something to drink because they're worried about being judged for their smile. And so if at least getting into a new set of dentures, they can get rid of that. Now, they may still have some issues with needing to get used to them as far as eating goes. There's going to be some limitations, but they at least can get the looks fixed that they've spent their life dealing with. And so at our office, we do more than just one thing. We do conventional dentures, immediate dentures. We do snap-in dentures that help give them some anchorage, so more confidence that your dentures and your teeth won't move while you're talking, as well as permanent teeth, to where they don't come in or out and you get to live your life more like you did before your teeth happened to go bad.
So like how old can you be to get this done?
Oh, you can be any age range. We've gone from the late teens for patients that have had genetic issues to as old as 88. I've had friends do 90, 92-year-old patients.
Why would an 88-year-old want to do this?
Same reason anybody else would want to. They want to be able to eat and enjoy their lives. Nobody wants to be relegated to having just what they can eat, whatever they can happen to get down, which is usually soft, it's mushy, it's very sugary. And so typically it leads you to having worse health just because you're not able to maintain high fiber diets, eating your protein. Okay.
So a 90-year-old, they're not more likely statistically to fall out?
No.
If a 75-year-old, like my neighbor, thinks they're too old for this, they're probably just wrong.
Oh, more than likely.
Do you ever hear that, by the way? A patient says, I'm a little bit too old for this.
Every day.
Really?
Every day, and then every day we show people how they've seen it wrong.
Now, I know you make dentures, but today we're talking about getting a brand new set of teeth supported by implants. But are there a lot of people wearing dentures, like in Oklahoma and Tulsa?
There's tens of thousands of patients that are wearing dentures or are soon to be in dentures. In the United States, there's currently 40 to 60 million people wearing a denture. So Oklahoma is no different. We've got many around. And out of all those people that are wearing dentures right now or soon to be, if they knew all of their options, they would all be flocking towards likely a better option, and there wouldn't be enough of us to take care of them all.
Now, correct me if I'm wrong. So the way dental implants are typically done across the country, you go to one place, maybe the imaging center, you get like a CT or something, or an X-ray. Then you go to another place that does the surgery, and another place where they put the teeth on top. You do it right there, like you're trained in both parts. Yes. Is that why you're able to do it so fast, so quickly?
So yeah, we've got a full in-house lab where we've got it built out so we can do everything, both conventional routes, digital routes. We've got in-house milling machines. We've got 3D
you make
printers.
the teeth right there?
We make everything right there. And the main reason we do that is, actually there's multiple reasons.
Okay.
One is cost. If we're not paying an outside lab marked up fees in order to get these prosthetics back, we can pass those savings on to patients. Two is speed. We don't have to wait on something to get mailed off and then get mailed back. And then three, we've all played the game where you whisper a message to one person and then they message it and they whisper it. And then it ends up being something completely different. There's so much that gets lost in translation, as opposed to when we're making these teeth in-house, we're directly going from the patient and directly adding it into their teeth. They'll speak directly with the technician that's making it.
So you used to do it the old way?
Yeah, I used to do it this way, and there's still plenty of places that do, and there's nothing wrong with it. It's just typically going to end up costing more and taking longer, and may not have as many personal choices on the looks on the back end.
Now, I know you brought a stack of photos, so we'll get to those in a second, but you mentioned, if we back up, you mentioned there's like tens of thousands of people in Tulsa, and probably more than 100,000 in Oklahoma that have an upper lower denture. If implant dentistry is so good where you can get teeth that don't come out, why aren't they all doing it? What's your take on that?
Oh, there's probably a few different reasons for it. One, if they're a current denture wearer, they may not even know their options. Denture wearers are notorious for never going to see a dentist. Once they've got it, there's really no reason to go back until they've got a sore spot, their denture breaks, they're worn out, discolored, broken, whatever it may be. And so they may not even know what their options are. And then typically, if you're a denture wearer and you go back to a dentist again, they talk to you about a denture. They don't necessarily inform you of what else is out there. Two, there's patients that are either in a denture, recently in a denture, or going towards one. They're really looking to get out of the rat race of dentistry. They've spent years getting fillings and crowns and root canals, extractions, bridges, partials.
So the last thing they want to do is see you.
Yeah, the last thing they want to do is sign up for something else that's going to lead them to more dental visits down the line. And so they just want the most complete, done, final thing possible, even if that means sacrificing quality of life wearing a denture. Yeah, and another reason is a lot of people have been told they don't have enough bone or that they're too old.
Yeah, but isn't it true? I mean, if you've been wearing a denture for like 10 years, 20 years, you may not have enough bone to do this.
Yeah, we get that quite a bit. A lot of patients that we treat have been told previously that they don't have the bone for implants. And all implant procedures are a little bit different. When we're talking about permanent teeth, we're able to utilize techniques that allow us to place implants in unique spots that give us the support to be able to build these bridges on.
So if they're healthy enough to like walk into your practice, chances are
typically, yeah,
that you can do this.
Yeah,
even on a 90-year-old, you say.
Yes, sir.
What's the oldest patient you've ever heard of that does this? Like from friends of yours
I've heard
colleagues?
some from colleagues that have either been approaching 100 or around it, which is...
That's very nice.
Yeah.
Now, but what if you're on medications? Because, statistically, if you're over 80, I think the average is 6 medications. That's what medical doctors tell me that come on this show.
Yep.
Can you be on medications and still do this?
Yeah. Really, there's very few medications or even health issues that will keep you from getting this treatment. And we'll go over all of that during the consultation process and going over your health history to
You'll
see
work
if
with their
candidate.
doctor?
Yep.
I mean, have you ever had to work with the doctor?
Oh yeah, multiple times. There's been patients that are on dialysis and they're getting this done.
Really?
Or anything else. Yeah. We just have to time it up.
You brought some photos. What are we looking at?
Great. So if you'll see this patient as she came to us, she had existing dentures that were years old. She never wore them, weren't comfortable, didn't like the way they looked, and was looking for other options. And so she came to us, and our first option that we provide to thousands of patients is just a good quality denture.
Like a cosmetic looking denture.
Yeah, get the
That's
smile
a
back
denture
and get
I'm
it
looking
comfortable.
at?
No, yes, sir.
That looks pretty good.
Yeah. Frames her smile nicely. You can see how much different she looks in the before towards the after. And one of these days, our goal, and we've been discussing it, is adding in implants, either snap to give it an anchored, something to anchor to, or make them permanent where they don't come in or out at all.
I mean, that's probably what everybody wants, right? Teeth that don't come out.
Yeah. With the way that we do things, we can easily upgrade people from going from their traditional dentures to adding in implants to snap and anchor them to and give more confidence to even making them permanent. So we can utilize the exact dentures we've already made for her to go into any of these other avenues. And out of those patients that have been wearing a conventional set of dentures and then moved into a permanent set of teeth that don't come out, most of them just are kind of kicking themselves for not doing it sooner.
Like a regret.
A little bit, yeah.
Is this one of those things where they say, I should have done this years ago?
Yeah, you know, you get in your head a little bit thinking that maybe this isn't for me, maybe I'm not a candidate for this or that, and never have really explored their options at all.
So what do they like more? Do they like the way it looks, or do they like what they could eat?
Both. There are some patients that come in solely wanting the looks. They say, "Oh, I want these teeth, and I want them to look so, you know, some certain way." And then once they get them, they find how comfortable they are in eating the foods they haven't in years. They're eating nuts again. They're eating steak again. They're eating ribs, biting into things without having to worry about their dentures popping out.
Can you eat nuts or chewy things with the implants?
Yeah.
Really?
Once we get to the final set of teeth, we make the final permanent teeth out of ceramics or nanoceramics that are either as hard or harder than your natural teeth. So you can eat whatever you want to. And then there are people on the other side of the spectrum where they come in, they say, "Oh, I just want to eat again. I don't care how they look. Just slap some teeth in, but I want something permanent that I can eat whatever I want in."
Okay.
But then what you'll notice is as they're coming in after with their new teeth, they're smiling a lot more. They're talking more. They're joking more, and they're really enjoying the looks. They're getting compliments. They're getting attention that they haven't had in years, and forgot what it was like to have nice, good-looking teeth.
Now you're a dentist, so you probably think like the smile's the most important thing.
Yeah.
How important is it in your view?
It's critical. I mean, you talk to anybody, even outside of me being a dentist. What's the first thing you notice when you meet someone new? Most people will answer their smile. If you ask them what do they remember about a favorite loved one that's passed on, a lot of times they'll answer their smile. It lit up the room. It gives people confidence, even when it comes to getting jobs or getting dates or making friends, whatever it may be. People with nice teeth tend to smile more. They seem more friendly. They seem more confident. Studies show that they seem more successful and well-educated. And so all of that just from good teeth. And contrary to that is there are a lot of people with bad teeth that are judged. Hollywood has used for years, and we've all watched TV shows where the bad guy or someone that's uneducated or poor, they've all got bad teeth, whereas the good guy, they've got good teeth. And so that's something that's somewhat
or like missing a front tooth. You see that even on Halloween, or buck teeth.
They'll do that a lot, and we've all been programmed somewhat to make those assessments of people with that. And so once you unburden someone and give them those nice teeth that they've always wanted, they get rid of all those negative feelings and thoughts of being judged.
Now your aunt had this done.
Yep. So she'd been wearing her a full upper-lower conventional denture for the last maybe 7 years or so. And then a few months ago, she came just to see what her options were. And so I recommended implants on her top and bottom to help lock these teeth in. But she decided, well, I just want to do my lower teeth. I want those permanent. I don't want to take them out anymore. I'm tired of it floating around. I'm tired of gluing it in all the time. And so we did her lowers, and now she's in her finals, and she's been happy. I actually saw her a few weeks ago, and I thought I was in trouble. She sat me down and she said, "Hey, we need to talk about something, and we need to talk about something serious." Thought I messed up. She said, I used to love my upper denture. I want the same thing done on the top that I had done on the bottom, just because now that I don't have to worry about it moving around, dancing around, putting pressure on my gums, I can eat so much better.
So it felt loose compared to the rock solid lower.
Yeah. And beforehand, she hated her lower denture, loved her top one. Now that her bottom's permanent in place, now she doesn't like wearing an upper conventional denture. And something that she didn't expect and looking forward to is with an upper denture, your palate is covered. So the reason that upper dentures have suction, it's got a part that goes over the roof. So that kind of forms a suction cup effect. With implants, we don't need suction anymore. And so we can cut the roof off. So then if you're sipping your hot coffee, you feel the heat. You're eating chips, you feel the roughness, you taste.
The salt.
Yeah, you get the salt. We've got taste buds on the roof of our mouth that are covered with traditional dentures.
Interesting.
They get unlocked and uncovered when we move into implant treatments. Here, let me show you this next patient. So,
all right.
This gentleman came to us seeking options, just like everybody else, because he had gone years with painful teeth, loose teeth, not the prettiest smile, hadn't eaten the foods he wanted to in quite some time, and his family is in the dental industry. And so he knew that there were options out there. He didn't know the specifics. he came in and really hit it off. He's actually from the same hometown as a lot of my family, which only has maybe, I swear, 10 people live in this town.
Okay.
So the fact that they're from the same place is crazy. But now, once he's gotten this, and he did permanent teeth on both his top and his bottom, came in for the day of the procedure, got it done, left with his new permanent teeth that day. And ever since then, he has been smiling almost nonstop. And every time I see him, he's talking about, oh, I don't have any trouble eating. We went on a cruise and I got to eat. I didn't have to worry about the different foods I can or can't eat. I didn't have to worry about breaking a tooth or anything like that. And so it's been a huge improvement.
Now, on that before photo, those teeth look really bad. Is it hard to eat with those kind of teeth?
No, it's very hard to eat with those teeth.
And does it hurt? Are guys like that? They wait until they're in so much pain, they finally do something about it?
And so you can see in the before, when they're missing teeth like that or they're in such poor condition, one, they hurt to bite into things. They can be very sore to put pressure on, as well as the teeth may be sensitive to hot or cold, whatever that may be. Also, when you're missing back teeth, it's really hard to chew. If you've ever wondered what it'd be like to eat with teeth missing, just chew with your front teeth and see how difficult that is. And so your ability to eat, enjoy the foods that you may want to, it gets severely limited when you've.
So in Tulsa, what do they want? Do they want steaks? Do they want salads? I mean,
it's.
I mean, could you even eat like things like beef jerky with these teeth? With permanent teeth?
You'd be able to once we get to the permanent teeth and the finals. So everybody wants a steak in Oklahoma. We're big beef people, but a surprising amount of people also talk about salads. You know, I haven't had a salad in years. I can't because of either my teeth are in bad shape, or I wear dentures and I can't make it happen. I'm just kind of rubbing my food together, but I'm not chewing the lettuce, I'm not chewing the tomatoes, what I wouldn't give to have a nice fresh salad again. And so we get both of those, both salads and steak.
Now, what about the people, and I have to ask you this question, people with bad gums, like gum disease.
Yeah.
Can they do this, or their gums are too bad to hold an implant?
Oh, all the time. That's one of our main patient types is gum disease. So with gum disease, the bacteria that is causing it is harbored by the teeth. So they're hanging around the teeth.
Okay.
Once we get those teeth out of there, it lets our gums heal. It lets them get back to normal like they were before they got that disease. So the implants are not affected by it as long as we take care of them and keep them clean.
So these
afterwards.
can last as long as you like brush them and take care of them. They're going to last as long as you last.
They should last just as long as natural teeth with the right care. So they're not. There is no expiration date.
So how soon could they eat after the procedure?
No, the same day. Now in the beginning we keep everyone on a softer diet as they're getting used to everything. But then it's not very long at all before you're back into burgers and French fries and all of that.
So you could eat like pizza, chewy things. I mean, really, there's just no limitations.
Yeah, there's no limitations.
Did they ever call you and say, or call your office and say, "Are you sure I could eat a steak? Are you sure I could bite an apple?"
Yep. Are
they worried a little bit?
We get patients all the time asking, "Oh, can I do this?" Because they're being very protective. You know, they've had a set of natural teeth before that went bad, and so now they're being extra cautious with their new set of teeth because they're worried that the same things might happen again. But these are actually much stronger than your natural teeth, so they can handle it.
Okay, good. Time for a few more photos.
So if you look at this next patient, so he came to us with a few different problems. And so he'd been to multiple dentists. He'd gotten treatment plans several different places. He had cavities on several teeth, many teeth actually. He's had pain for years. His gums were starting to give him trouble. He did not want to go down the path of fixing all of these teeth. It was going to be a big, long process. So he elected to get them removed, get brand new teeth and change the way he looks. And so if you look at the before, you can see the teeth a little darker, got the gap in the front teeth a little bit smaller. And so you move over to his after now. And if you're looking at the before and after, which one would you prefer? Which one do you think looks like the more educated person, more successful person, the more friendly person?
Good point.
It's going to be probably the after. And something else to point out and brag on my team a little bit. If you look at this after, you can see that these teeth we're not just taking them out of a box and giving you new teeth. These are custom made. You can see how well it fits his smile. It frames perfectly between his lips. Everything is very custom to him to be the best version of what his smile can be.
When they look in the mirror for the first time, what's that like?
For a lot, it can be very emotional. We definitely get a lot of patients that tear up or cry when they get these procedures done, and other patients that don't immediately get the big emotional breakdown when they see their new teeth. What we do notice is as they come in for follow-up appointments and everything else, they're much more excited, they're friendly, they're smiling, they're enjoying their life more and very confident in who they are now.
This is a procedure that seems like very painful.
Most people plan on it being very painful, but the truth is we get everyone nice and comfortable, very numb, so that they're not feeling anything. They might just feel a little push here or there. With the implants, there is no sensation. You don't feel that part at all. And then when we're talking about these permanent teeth that people are leaving with that day, after they go home,
Do they have some sedation, by the way, during the procedure?
Yeah, we offer sedation. And so between the numbing and the sedation, even a lot of times we'll do these cases and people not take anything, and we're just chatting throughout.
That's nice.
It's not as invasive as you might imagine. So a lot of people are still telling stories and jokes during the procedure.
I'll rush you a little bit because we got about 3 minutes left, and I know you have a stack of photos. So
we got a lot.
What else are we looking at?
All right. So this next patient has been very interesting because she came to us less than 2 months ago. Has been wearing a partial denture for years, has not really enjoyed wearing it, both because not as confident in the smile when you're matching some fake teeth up front versus your natural teeth, and then also the comfort. You're not able to comfortably bite into foods as well as you chew. It's like wearing a retainer as you're trying to eat, so it's something moving around in your mouth. She wanted something else, and she came in, she said, I want something permanent. Wouldn't have any other...
Teeth that don't come out.
Teeth that don't come out. She wouldn't let me talk about anything else. And so her sister was with her for her examination. And so in wanting a permanent option, the best thing that we can do is in one day, she comes in, as you see in these photos here, and then leave later that morning with a new set of permanent teeth that don't come in or out. And then so she left, came back the next day for her 24-hour follow-up. And as we're talking to her, her sister said, hey, I actually want to do the same thing.
Really?
And so then we went through the consultation process with her, got her a treatment plan, and then a week to 2 weeks later, exact same thing, a new permanent smile up top, nothing moving. She was so happy that then their brother came in, and about 2 to 3 weeks later, he did the same thing. All of them got brand new permanent upper teeth that don't come in or out, and it was all in the same day.
Now, for people just tuning in, just a little bit of a recap. I guess your world record is in little as like 2 visits. You could give people upper and lower teeth that don't come out because you have the in-house lab. That means you make the teeth right there. You do everything right there. Is that right?
That's right. We make everything there, and when we do these cases, we generally put everyone into a trial set of teeth for a few months so that they can test drive them, see how they like.
And those don't come out either.
They don't come in or out.
Okay.
They're going to look the same as their final. They're going to look and function very well. But what that allows is someone to try it out. We've all had great ideas about a new haircut, and then you go get it done. You look in the mirror and think, well, that maybe wasn't a good idea. So if patients want to make their smile bigger, smaller, whatever the case may be, sometimes they regret it. And so if we do this trial set, they're able to try it out see if they actually like it, get input from friends and family. They're keeping a list of anything they want to change when we make their final teeth.
But most people are happy the way it is.
Oh, vast majority just say, hey, I just want these the same as what I've got right now. And then if you look at the next, here's her sister. And so this was the case just a few weeks later. Again, same thing, came in wearing an upper partial, did not want anything removable, was tired of the in and out and cleaning and wearing goop. And so she wanted something permanent, came in and got it, and it went tremendous. So she got her permanent teeth same way. Now with this next case, he's been one of our office's favorites. Going from the beginning until now, had come in with teeth that had been bothering him for years, had pain both on top and on bottom, had lost all of his back teeth, and so for the most part just had
so he couldn't
front
eat.
Teeth. Eating was very difficult, was very self-conscious of bad breath all the time, was worried about being around people, so kind of held him back socially because he didn't like his smile because of missing teeth and all of this.
So the bacterial infection makes their breath bad.
Yeah, it can.
Okay.
I mean, that's one of the main reasons that people go to the dentist anyway, not necessarily for implants, but just in general. Gum inflammation, gum disease, all that can lead to a lot of the bad breath that we're...
So I interrupted. So he comes in. His only option was a traditional denture. And what did you do?
And so what we ended up doing is similar to some of these other cases. He got some permanent teeth in a day. So he got upper, lower, brand new teeth. Left, you can see how much... how great that smile looks after. He's grinning everywhere he goes and is 10 times more confident than when he first came in. And so look at his after photo. You can see the teeth are beautiful. They look great. They look great on him. But what do you notice? He's not smiling real big yet. And that's because he spent years hiding his smile. Hasn't been broadcasting at all. So now he's actually got to learn to get comfortable again in going around and letting it all be seen.
See, before you know it, this guy's going to be smiling all over the place.
Oh, he's already
Selfies
there.
on Facebook.
He's already there.
Do you ever get on a consult and they're telling you their hard luck teeth story, and you can't help but get excited because you go, they have no idea how good this is going to be.
Yeah, all the time. I mean, that's something that we see, especially those patients that have struggled. They've had a lot of missing teeth for a long time, whether it's conventional dentures that they've gone with no teeth for years, or people that have, like this, where they're missing a lot of their teeth. They haven't eaten normally in years. And so those are the ones that I get most excited about because they're going to have such a dramatic change in their life and their ability to enjoy things.
Now, we have to mention this, and we got about a minute left, but insurance, even the best dental insurance doesn't really cover this, just a small portion. Medicare, Medicaid doesn't almost cover this at all.
Yep.
So what's the answer here?
They're financing it. So most,
90+%
of our patients finance at least some portion of this when we're talking about implant cases, the permanent teeth in a day, all of that stuff, people are financing for the most part. We've got dedicated people in our office that are looking to get you set up with financing. So if you've got decent credit, they can lead you to the right lenders. And we've also got team members that spend their day looking at your insurance to get the most that they can out of it to make sure that you're maximizing your benefits.
Okay, good. So we're out of time. Final message. People are watching this. They're of the two groups. The bleeding gums, the bad breath, the bad teeth that are headed to dentures. And then there's the other group that are currently wearing dentures. Maybe you even made the dentures for them. And they've heard what you had to say, but they're still skeptical. What do you say to them?
Come talk to us and let us take a look and see what we can do for you, see what your options are. Now we may end up doing a conventional denture to where we can fix your smile and get you back to normal that way. But then we can also add implants with the snap-in kind that'll allow you to be more confident in your teeth not moving when you're talking to friends and family, or even the permanent teeth that don't come in or out and let you eat more normally.
So the basic options are snap-in, snap-out teeth, or upper and lower teeth that don't come out.
Yeah.
Is that right?
Yeah.
Okay, good.
And we can help guide and answer all the questions along the way to get the treatment that really works best for you.
Do they get to see you on the consult?
Yeah.
Every time? Well, good. Good for you. I want to thank you for coming on the show. What's the best way to go? Did they go online, make an appointment, or just call your office? Call the office. All right. Thanks again.
All right. Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.